next video that Dr. Lovegrove is going to talk to us about is the efficacy and safety of Abrocitinib for Prurigo Nodularis and chronic pruritus.
So one of the other late breakers I found particularly interesting was that of Dr. Sean Quatra, who presented this investigator-initiated trial using Abrocitinib in Prurigo Nodularis and chronic pruritus of unknown origin. So Abrocitinib is a JAK1 inhibitor that's approved for use in moderate to severe atopic dermatitis in Canada. And this was not placebo-controlled. It was an investigator-initiated trial, like I mentioned, and they basically took 10 patients with prurigo nodularis and 10 patients with chronic pruritus of unknown origin and put them on Abrocitinib 200 milligrams PO daily. So that's the higher dose of Abro. They saw really great results in this trial as well. So the majority of patients had a really great response. So significant reduction in pruritus by week 12. The other thing that they saw was there was a rapid time of onset, and most of the patients who had a response did see a good response in pruritus decrease by around 2 weeks in the study. The other amazing part of the study was that Dr. Quatra had some clinical photographs of patients who had prurigo nodularis and showing before and afters. And so he showed some particularly impactful photographs of patients with these very exophytic, very fibrotic nodules, especially the type we see in patients with skin of color. And the before and afters were striking. So seeing this really nice clinical improvement as well for our prurigo nodularis patients. So I was excited by this, of course, because this is a potential off-label treatment for these patients with chronic pruritic disorders that can be very challenging to treat, and this could be a potential use in Canada as well. Well, that's it from me. I hope you enjoyed my insights and my feedback from the sessions for those of you who couldn't make it. And Ron, I hope that wasn't too much itchy for you as well. Okay, bye everybody.
The Abrocitinib that was spoken about for prurigo nodularis, as well as chronic pruritus of unknown origin, which is abbreviated CPUO. Well, thank you very much to the Chronicle and to BMS for sponsoring this edition of the updates in EADV. And I want to thank all of our reporters, Dr. Lovegrove, Dr. Prajapati, and Dr. Kirchhoff. This is Ron Vender signing out for another EADV, this one 2023 in Berlin. Thanks for watching, and I hope you enjoyed our updates.